we're joined by a passionate advocate and trailblazer, Adrienne Griffin, co-founder and executive director of the Maternal Mental Health Leadership Alliance, MMHLA. I'm your host, Bria Anopise, and I'm joined by co-host Jamie Agunste, a maternal mortality abstraction program coordinator. Jamie, I'm now going to turn the podcast over to you.
Thank you, Bria. And thank you, Adrienne, so much for joining us. You have a wealth of knowledge, and I'm so happy that you are able to spend a little bit of time with us today to talk about maternal mental health with AWHONN nurses and all of our listeners. Can you start off by telling us a little bit about your organization and how you got into the work of maternal mental health, please?
Absolutely. Well, thanks, Jamie and Bria, for welcoming me to the show today. Really super excited to be here with you and to talk about this subject, which is just near and dear to my heart. It really is my passion project. And the reason I got involved in this work is because my personal lived experience, as we find very often with folks who work in this field, whether it's personal lived experience or somebody that you know, your sister, your mother, we all know somebody who has experienced a maternal mental health complication. Anxiety and depression are the most common complications of pregnancy and childbirth, impacting at least 1 in 5 women. And so I often say to people, if it's not you, it's somebody in your circle, your mother, your sister, your best friend, your next door neighbor, your college roommate. We all know somebody, we just don't talk about it. And that's partly why I do this work, because when I experienced maternal mental health conditions 22 years ago when my son was born, people just weren't even talking about it. We've gotten a lot further. We're talking about it. We have things like this. We have podcasts that address this issue. It's a topic that is included in many, many conversations and conferences, and our nation is paying attention to this. So again, I experienced these issues, like I said, 22 years ago, and I knew immediately that something was wrong. This was my second baby. I had a really easy pregnancy and childbirth experience and had with my first child, and she was a super easy baby. So much so that, I joke around, but we had a big dinner party with like 40 people when my first daughter was only 3 months old, because she was sleeping through the night. She was sleeping like 12 hours at a time, right? And taking these big naps. And we're like, let's have a party. And then let's have another baby. And then, the second one was a completely different story. I had a very scary emergency C-section. He was a much needier baby, a much more normal baby, I say. But I was exhausted and overwhelmed. I had a toddler and a newborn, and I just couldn't get it together. That I felt like I was drowning, right? And I knew something was wrong, and I kept reaching out for help. And this was the hard part. It took me like 6 months to get the help that I needed, because I didn't know anything about mental health. I had never had a mental health experience before. I didn't know what this whole behavioral health system was. I didn't know the difference between a psychiatrist and a psychologist. I knew nothing. I was, treading water and barely able to get my head above water, and somebody was throwing more water in my face. And so it was during that really dark time in my life that I decided I got to do something about this, right? If I have trouble finding help, and I speak English, I have insurance, I have a husband, I have the internet, I had family support. Like, if it's this hard for me, what about somebody who may not even realize that something is wrong, may not be able to, persevere, maybe, they're don't have family support, whatever. So that's sort of like started my passion around this issue, right? We all need to be talking about this. We all need to be normalizing it. And most importantly, we need to be helping moms get the help that they need.
Yes, absolutely. Thank you so much for sharing that. Can you tell us a little bit about the Maternal Mental Health Leadership Alliance and how it got its start and your role in it?
Sure, absolutely. So I'm the executive director. We launched just about 5 years ago, and we came into existence because there had been a couple of advocates who had been going to Capitol Hill and advocating for some federal funding for some programs, including a series of grants to states to create programs in their state. And my co-founder, or Jamie Belcito, who's really the founder, she came to me. She's like, we need to start this organization. We need somebody to keep a focus on national policy. And she's like, I'll tell you what, you run the organization. Jamie said, and I'll run all the stuff on Capitol Hill. That's what she used to do. She had been a lobbyist and an advocate for many, many years in a different topic. And I'm like, okay, great. Sounds good. I'll do all the fundraising. I'll run the organization. You run all the policy work. And so that's how we came into existence. And prior to this, I had led a nonprofit in Virginia called Postpartum Support Virginia for 10 years. And so it was loosely affiliated with Postpartum Support International, which many, many folks know as the go-to organization for issues around maternal mental health. And so I had started there as a volunteer many, many, many years ago, and then launched my own nonprofit in Virginia, ran that for 10 years, and then came to MMHLA. And what we do primarily at Maternal Mental Health Leadership Alliance is really focus on advocacy work. So federal policy. So we're the folks who have advocated for things like the National Maternal Mental Health Hotline, for continued grants to states to create psychiatry access programs. And we support other organizations that do advocacy work. So that's our primary goal, is focusing on federal advocacy work.
That is fantastic. And I shared with you as we were beginning this podcast that over the last couple of days, I've been catching up on AWHONN sessions from convention that I didn't get to see. And yours was one of the ones that I listened to. And it was a fantastic session. If anybody has not seen it, it was called The Maternal Mental Health Crisis in the United States, a Call to Action. And if you were at convention, you can still log into the app and watch this. And you can also receive contact hours or nursing credits for this. So I would encourage everybody to take some time to listen to Adrienne's session, because it really was fantastic. And it really brought me back to, while I was listening to this, it really brought me back to the experiences that I had when I had my own kids. I have an 8-year-old and a 13-year-old. And I was not a nurse when I had my 13-year-old, but I was a nurse when I had my 8-year-old, and my now 8-year-old, obviously. And I remember sitting there in the middle of the night when I was nursing my baby, up feeding him. And I did have a group of friends through a breastfeeding support group that I was involved in. And we were texting each other like in the middle of the night. Our babies were all born around the same time. And it was like, who's awake? Who's up feeding the kid? And there was always somebody awake. And so if we were having problems, feeding the baby, or if we were just struggling in any way or dealing with sleep issues, we could reach out to each other. And I know not a lot of, families and parents have that, and it can be really isolating. Can you tell us, because this really came up in your session yesterday, a little bit about the Maternal Mental Health Hotline and how that might help somebody who's like struggling in the middle of the night or really needs somebody to talk to and doesn't have that support?
Yep. Jamie, that is exactly why we advocated for funding to start a national maternal mental health hotline. Because I remember being up in the middle of the night with my son, and he was born in December. So it was like night was like, half the day, right? It was 12 hours of darkness, and being up with him and thinking, I am the only person in the whole wide world who's awake right now. And there's nobody I can reach out to. And so, we were like, there has to be something. Like you said, you had these friends that you could text in the middle of the night. That's what the National Maternal Mental Health Hotline is. You can call or text 24/7. And folks, the people who staff the hotline are women, primarily like you and me, who had the experience, who have gotten through it, and who want to give back. And so they are either certified mental health providers or peer support specialists or doulas or lactation consultants. And they can be that listening ear in the middle of the night and can say, hey, you're going to get through this. I'm going to hold your hand through this. We're going to get you connected with resources. And so often that is the first step in getting that mom the help that she needs, where she could say, oh my gosh, I am not alone. There are other people who have gone through this and they are going to help me. And that right there, begins the bridge to wellness.
Yeah, definitely. And I think just acknowledging the fact that, that there are these, just acknowledging the fact that this time can be really isolating and it's really hard to be, awake and up. We were talking as we were getting ready to record about the impact of sleeplessness and lack of sleep when you first have that baby. Can you tell us a little bit about how that combined with other issues, right in the immediate postpartum period, like lack of sleep, maybe some feeding issues, lack of support. Can you talk a little bit about how those issues might contribute to, maybe some maternal mental health complications?
Absolutely. So lack of sleep is such a huge issue. We are told all during pregnancy that exclusive breastfeeding is the best thing for the baby. And it might physically be the best thing for the baby, but sometimes it can maybe not be the best thing for the mother. If, like with my son, I think this is what contributed to my experience as well. Not only did I have a very scary C-section, but then he would not take a bottle. And so I was up every 2 to 3 hours for like months on end. I often go back to his baby book and I'm like, oh, he sort of started sleeping and then he would regress. And then, so anyway, lack of sleep. So here's what I know. The human body cannot exist without 4 to 5 hours of uninterrupted sleep on an ongoing basis. Now, you can do it for the short term, 2 or 3 nights, or maybe 2 or 3 weeks, but then like your body needs that deep restorative sleep that you only get if you have many hours of sleep strung together. And so, if you're getting 2 hours, 3 times a night, that is very different than if you're getting 6 hours consecutively. And so I always say to new parents, look, the most important thing you can do, the most effective, least expensive intervention is sleep. And, so we ultimately had a 3rd child and we put a lot of things in place, including protected sleep. So like we had a 4-year-old, a 2-year-old, and a newborn. And so we would get the 4-year-old and the 2-year-old to bed at 8 o'clock. And I would go immediately down to the basement, earplugs in, sleep mask on, white noise, whatever. And I would get, 4 to 5 hours of uninterrupted sleep. And I was primarily breastfeeding. So I would wake up and, have to take over. And then my husband would switch. So then he would get his 4 to 5 hours of sleep and I'd stay up with the baby. And I mean, it's not romantic, right? It goes against all the grain of the beautiful pictures you see with the mother and the baby and the dad all cuddling together. Like this was about survival, right? My husband was going off to work every day. I was at home with 3 little people that I needed to take care of and keep alive. So I needed my sleep just as much as he did. And I often will talk to new moms about this and they'll be like, well, my partner has to go to work. I'm like, and staying home with a baby is not work. Like this is the hardest job ever, right? Keeping another human being alive. And it's so funny. Like I will talk about sleep with anybody all day long. In fact, there is this young family in our neighborhood that we have befriended, and both parents, both mom and dad, are pediatricians. And they recently just had their first baby. And I had said to them, look, here's the most important thing, sleep. And they were walking the baby the other day and they're like, thank you for telling us that. Once we got breastfeeding well established, they like, we split the night shift, and they're like, and they both said now as pediatricians, they're like, I am now going to be a much better doctor and talk to the new parents about their need for sleep. Yeah. I see Breeze over in the corner clapping. I mean, sleep is not going to solve all your problems, but at least it's going to help you function at a somewhat normal level, right?
Yes. Well, I think that with this audience, I think a lot of us can relate to that, not only as, possibly parents, but as nurses, because I spent 7 years working night shift. And so my sleep was never straight. So you would work, maybe, work a night shift and then come home, and then you want to sleep for a couple hours, but then you also have like stuff to do during the day, or you might have something at your kid's school. So you might be like, you know what, I'm going to grab 2 to 3 hours of sleep and then I'll come back and then go to bed at a normal time so that I can have like a normal sleep schedule. And that's what a lot of us do on a regular basis. And I really like to, when I talk to nurses, I like to kind of talk about Maslow and Maslow's hierarchy of needs and how sleep really plays into that. And as a parent and, as a nurse, as a new parent and, even when, as nurses, we're all expected to kind of function on like the higher part of that pyramid, but really our needs are not being met at like a really basic level, because when you're a new parent, you are just not getting that sleep. And you're right, sleep is not going to fix everything, but it will sure help to sort of improve just how you feel a little bit. It's amazing what like a little cat nap could do. And I went through that with my son, where he was so colicky, and I did not have that experience with my daughter. And so for the first like 6 weeks, he always had his like witching hour, where at like 6 o'clock at night, he would start crying, and it wouldn't stop till like 2:30 in the morning. And I would have my sister would come over and she would bounce on the exercise ball and with him. And I would just be like, I just need to go rest and, sleep a little bit and not hear him cry. And it's amazing, people who have that support are really fortunate and still can be, like you said, impacted by mental health issues.
Yeah. And whenever I talk about sleep, I talk about like splitting night shift with your partner, and you talk about having your sister come over. And oftentimes parents will say, well, I'm a single parent. How do I do this?
Yeah.
And it's like, okay, do you have family, right? Mother, sister, aunt, neighbor, cousin? Is there somebody from your faith community that you could tap into? Do you know another single parent and you guys have a sleepover over the weekend? If you can then split the night shift, with a friend, if you can get 2 or 3 nights where you're getting some of that deep sleep, that can get you through a little bit more, right? And so again, it doesn't have to be every night. And I really encourage families, young parents say, okay, try it over the weekend, right? Nobody wants to split the night shift. I get it, but just try it over the weekend. And then you can say to your partner, whatever, oh my gosh, I feel so much better. Can we do this for 2 more nights? Oh, and then suddenly, you can build this up, and then suddenly the baby's sleeping longer. And so it's also, you really have to realize that this is short term, right? This isn't forever, right? If you can do this for a couple of weeks or a couple of months and get through this, then everybody's sleeping better. And and we would go through this every time we would take our kids away. We'd come back home and their sleep schedules would be off. And we're like, okay, everybody's going back to boot camp, right? We're going to split the night shift, Everybody's back in their own beds. There's, everybody's got to start sleeping again. Yeah. Sleep is just so important. Yeah,
it really is.
And, when you talked about the Maslow's hierarchy of needs, we have this, what we call the steps to wellness in recovering from maternal mental health condition. And these are basically things that anybody who's experiencing a mental health condition can benefit from. And so the first thing is always this self-care. We talk about sleep, making sure you're getting a little bit of exercise every day. And I don't mean like running the Marine Corps marathon. It's like getting outside, take a walk around the block, get some fresh air, adequate nutrition. We talk to moms about, do you sit in the same place every time you sit down to feed the baby? If so, stock the feeding station, like put a cooler there. If friends or people are asking, what can I do? Stock the cooler with, some snacks, a sandwich, yogurt, nuts, whatever, water. So whenever the mom sits down to feed the baby, she can feed herself. Because I remember, baby would wake up screaming, you grab the baby, sit down as soon as possible. And then you're like, oh my gosh, I don't have my water bottle. I don't have my phone. I don't have everything
trapped.
I need. Right. And then you're trapped. Yep.
You're trapped under the baby for like a half an hour.
Exactly. Exactly. Right. So there's that whole self-care. And then there's the social support, right? You said you had this great group of women that you texted with. How important that is. We talk about support groups or peer support, have a mentor, get some of that social support. And then next up the step is therapy or counseling. How important it is during this time frame. And we're talking very short duration. It's not like lying on the couch, psychoanalyzing everything about your life. It's like short, pragmatic. How can we help mom get some more coping skills? How can we teach her some mindfulness, some breathing? How do we teach her when to walk away, like you said, with your colicky baby, when to put the baby down and walk away, right? And then the next up is psychiatric medication. But not everybody needs to see a psychiatrist and be on antidepressant medication. Sometimes those earlier things like the sleep, right, like the coaching, like the peer support, that can be enough to help mom get well.
Mm-hmm. Yeah, that's fantastic. Is that a tool or like something that's available through your website that people can see? Or
Absolutely. Yep. It's called The Steps to Wellness. And I'll give you the link later, but it's on our website. We have a whole fact sheet library, and this is one of our fact sheets. Yeah.
That's
so
fantastic.
actually, back to one of your original questions is, what does MMHLA do? One of the things that we really do, we focus on, is curating information for the field of maternal mental health. And so we have a whole resource library. We have a resource hub that includes our fact sheets and webinars and learning opportunities. And so anybody who's interested in learning more, check out our website. We think of it as, if you get to our website, you either find what you're looking for or you get directed out to the organization that can help you find what you're looking for.
Okay. That's really good. And as somebody who also had a December baby, I had a December baby and a January baby. And I know my first daughter was like born in January, and I was like, I'm never doing this again. And then there I did. Totally did it again. And in New Jersey, you're not going to be out like walking your baby in December and January outside. So I spent a lot of time at the mall, just like pushing my kid around or kids. When my son was born, letting my daughter kind of run ahead a little bit and just to like get out of the house because you just feel like you're going to go insane being trapped inside in those winter months or right now, if people are having babies right now, it's super hot and not always safe to be outside, but it is a good idea.
Yeah, I want to
change of scenery.
Tell you about a great class that I used to be involved with when my kids were little. It was called Stroller Strides. I think it's now called Fit for Mom, but they do exercise classes. And in the winter, we would meet at the mall. Exactly. And we would, meet before the stores opened and would do our exercise. And again, it got you out of the house. You got to see other people, put some schedule into your life. Change of scenery, just all of those things. Super helpful if you can find an organization or a class like that.
Yeah, I think Dr. Nastasha Harris's organization in New Jersey, it's a perinatal health equity initiative. They have a group called Sisters Who Stroll. And so it's like they get moms together just to go on walks, right? So you have that like the community, community support, you have exercise and activity. Like you said, you're not running a marathon, but just getting outside and getting some fresh air and being in community with other people who are going through what you're going through.
Absolutely.
Amazing.
So helpful. Yep.
Yeah. Peer support is amazing. I wanted to change gears a little bit. Can you tell us about some of the activities that your organization participated in May for the Maternal Mental Health Awareness Month? Because I was looking at some of your resources and girl, you were everywhere, right? Like you were all over the place. So I would love to hear about some of the activities that you did, especially maybe in DC and on Capitol Hill and advocacy work.
Oh, yeah. So May was super busy, man. My suitcase was rolling. Yeah. So the big event.
Those wheels were on fire.
In fact, some friends bought me a new suitcase after all of that. So May is Maternal Mental Health Awareness Month. And so there's lots of activities that go on. The big event that we had was an event on Capitol Hill, because again, our primary focus is federal policy. And so we hosted this event on Capitol Hill, and we invited staff members from all of the different offices who address maternal mental health. And so we discussed some legislation that we have introduced called the MOMS Act, which would implement some of these evidence-based prevention programs in the military setting. So we know that military mothers experience mental health conditions at almost twice the rate as their civilian colleagues, because of things like they're separated from their family of origin, frequent moves and deployments, concern about your loved one who may be deployed, in harm's way, lack of social support, so we're trying to do more to support the mental health and well-being of our nation's military mothers. And so we talked about our legislation that we've introduced called the MOMS Act. We talked about the hotline, which is really, I think of the maternal mental health hotline as kind of like my fourth child. I'm so proud of it and all the work that is going on there. And so we had, a big event on Capitol Hill, which was really terrific. And oh my gosh, we were everywhere. And now you're asking me where I've been. Okay, that was like 2 months ago. I'm like, I can't even remember. It was yesterday. But one of the great places I went recently was the AWHONN convention. Can we talk about that?
Yes, please.
I just tell you, yes. So MMHLA and AWHONN are partnering this year as education partners to really raise awareness about maternal mental health. And so one of the things that we did was do a presentation at the AWHONN convention, which you mentioned. And we also led a pre-con workshop with about 15 people where we really did a deep dive. And we had Sarah Moyer with us from Virginia Commonwealth University. She has taken the screening tool that is most often used, called the Edinburgh Postnatal Depression Scale, and has updated it so it's more relevant to today in the United States. And so she was able to share that. She walked through it. She did sort of a role play with it. And we really talked with this smaller group about how to implement screening and treatment programs within your own practice, how to talk to moms. We did some role playing. It was really, really terrific. And I got to tell you, I loved being at AWHONN. It was just so great. The energy, the positivity, all of the folks that we talk to, all of you nurses really understand the importance of women's mental health and want to do more to support it. And so we were so pleased to be there. I was showing you, I brought back my books and everything from the conference. There's my guide from AWHONN's Guide to Pregnant and Postpartum and Newborn Care. The convention, the exhibit hall. I've never seen this. People were like lined up at the door, couldn't wait to get in. Like the doors open and people rushed in like it was a concert or something.
Yeah.
And it was just, the energy was so terrific. I'm so thrilled to have been part of all of that.
So you were kind of all over the place at conventions too. So you guys had a booth, right? Your organization had a booth, and we
didn't have a booth. No, we didn't. But we did the pre-con workshop, which was on Friday, right? And then a presentation on Sunday. Yeah.
Okay. Yeah. Okay, that makes sense. I wanted to ask you a little bit about maternal mortality in the United States, right? So that's like some of my primary work is to assist with maternal mortality review in the United States. Can you talk a little bit about maternal mortality review committees and how they have contributed to like the knowledge that we have about the impact of maternal mental health on maternal mortality?
Absolutely, Jamie. I feel like you just teed up like the most incredibly important question. So, right, we all know the maternal mortality rates in our country are abysmal, right? They were decreasing for many, many, many years and then started increasing again in the early 1990s, I believe. And California was the first state to see, hey, what's going on here? And so they launched a maternal mortality review committee. And what these MMRCs are generally speaking, state-based organizations, very multidisciplinary. And they review all cases of death, either during pregnancy or the first year following the end of pregnancy. And so they have access to a much wider range of records, not just death certificates, but medical records, social services records, if there's any police reports. They do interviews with families. They just really dig in to really understand what is the underlying cause of this death. And these MMRCs are the organizations that have identified that mental health conditions are one of the leading causes of maternal mortality. It depends on which year you look at and which states. So in 1 year, mental health conditions were the leading cause of maternal mortality, right? So we're talking about substance use, overdose, and suicide. So this is just tragic. Not only are our maternal mortality rates going up, but we're seeing that mental health conditions are a large cause of that. A lot of these deaths by suicide or overdose are happening in the late postpartum year. So oftentimes people have stopped screening. People just think, oh, I need to screen for postpartum depression at the 6-week postpartum visit. Pediatricians are currently suggested or encouraged to screen at the well baby visits at 1, 2, 4, and 6 months. So what we're doing is encouraging them to continue to screen throughout the rest of that postpartum year, because the research shows that the peak incident of postpartum suicide is late in that postpartum year, like 6 to 9 months. And so these MMRCs have been terrific in identifying, bringing us the data so that we can drive policy. So we take that data, right, and we go to places like the American Academy of Pediatrics or the American College of Obstetricians and Gynecologists and say, here's the data. Here's what you need to be doing about it. You need to be continuing to talk and screen all the way through that whole pregnancy and postpartum year.
Yeah, thank you. Thank you so much for talking about that. And I think that one of the benefits of maternal mortality review committees is that they follow it out through the whole year, right? Like the year after the end of a pregnancy, like 365 days, regardless of how the pregnancy ends, whether it's a live birth, a stillbirth, a termination, a miscarriage. And whereas I think when you look at other measures of maternal mortality, they follow it through the first 42 days. And so I think that when we follow out through the whole year, we really do see certain types of morbidity lead to mortality. So whether it's, the suicides or the overdose and cardiac disorders as well tend to be in the late postpartum as well. So Thank you for speaking to that. And I think that in the last couple of years, as CDC has released information about the impact of mental health disorders on maternal mortality, I've seen, and I'm sure you've seen this too, just like an overwhelming and really fast ramp up of talking about maternal mental health.
Yeah.
Which I think is fantastic because it breaks down that stigma. Can you talk a little bit about like the stigma and why we like separate out like the head from the rest of the body when it comes to, complications of pregnancy?
Yeah. So I want to just finish off with one more remark about the MMRC. So as you pointed out, right, they look at that full year postpartum, and they look at deaths by suicide, homicide, overdose. Whereas some of the other reporting mechanisms through CDC, right, you said only go 42 days, and they don't count those deaths by despair, right? So that's why we really have been using the data from the MMRCs to drive policy. Yeah. So, so back to the stigma. Well, if you Google photos of mothers and babies, what do you see? You see all of these beautiful pictures, right? And I always start my presentation. It's like all these gorgeous pictures. Everybody looks calm and peaceful. The house is clean. The baby's sleeping, and in reality, that is, it was not like that in my house. I'll tell you, there were babies crying. There were moms crying. It was a disaster. Right. And so I think, first of all, there's this expectation that pregnancy, postpartum, it's supposed to be lovely and beautiful and natural and easy. And it can be. And for some people it is. But for many more people, it can be really, really challenging. And so I think the first thing is starting to dispel some sort of that myth around motherhood. And then there's this whole thing, you're right, the separation of the head from the body, right? How we have, we have mental health and we have all this other health. Well, your mental health is your brain. Your brain is an organ. It is like the rest of the body and needs to be addressed, right? It's not like, and it controls everything. But the way our medical system is set up, right? There's psychiatry, which takes care of the brain, at least the mental part of the brain. And then there's the rest of the body. And so if a woman, for example, comes into pregnancy and she may be on antidepressant medication, oftentimes OBs are not trained in whether, how to treat pregnancy related mental health conditions. And so they'll say, you need to come off your medication, which is absolutely the wrong thing to say. Similarly, a mom or woman may be seeing a psychiatrist and she becomes pregnant, and the psychiatrist has not been trained on how to treat women who are pregnant. And so the psychiatrist will be like, I can't treat you anymore. You got to go to your OB. So there's often this sort of this finger pointing, and that we're seeing more and more training happening across, sort of breaking down those silos so that psychiatrists are being trained on how to treat pregnant and postpartum people, as well as OBs are being trained on how to treat mental health conditions of their population. Again, this is the most common complication of pregnancy and childbirth. 1 in 5 women. We no longer can we say we don't want to talk about it. We won't want to hear about it. We don't want to see it. It's real. It's here. Yeah.
Yeah, absolutely. So we have a lot of dire statistics, right? But can you talk a little bit about what gives you hope in some of the work that you're doing and the actions that are being taken and the policies that are being implemented and changed, either on a local, regional, or national level?
Yep. So I just see how many more people are in this field, how many more people are talking about this. So again, when I had my son 22 years ago, I remember somebody told me about this book, What to Expect When You're Expecting. I'm sorry. So that's the Bible that we all know about. The other one is This Isn't What I Expected, How to Overcome Postpartum Depression. I had heard about this book, and this was back before Amazon really was a thing. And so I remember going to the library and I didn't have the book. I remember going to like Barnes and Nobles or Borders and being like, do you have this book? It's called blah, blah, blah. And like bursting into tears. They didn't have the book. I finally found the book somewhere. I don't know. But now there are like scores of books written about postpartum depression or maternal mental health conditions. And you just go on Amazon and click it and it's in your house the next day. So there's more people talking about it, more people writing about it. And the fact that like I was invited to the AWHONN convention to do this presentation, right? People are interested in learning more about this. And as all of that is happening, people are becoming less afraid of these issues, right? And we're giving people the vocabulary to talk about it. And like, for example, one of the things I spent a lot of time talking with nurses at AWHONN is like, how do you bring this up? You know, you have to be like, oh my gosh, I don't want to offend you. You don't look sad. No, you just say very calmly, anxiety and depression are very common during pregnancy or postpartum, checking in to see how you're doing. I had this experience. I can help. Right. Just saying that. I mean, that took what, 5 seconds? Just saying that can normalize it and maybe have a mom say, hey, yeah, I am struggling and I didn't want to talk about it. And really start to like dispel the stigma around mental health. I don't know why this persists, right? That mental health is something that we don't talk about. We're afraid of. It's embarrassing. I don't know. It's just health. It's part of your whole body. So
yes,
what gives
it's a holistic sort of view.
Exactly.
You have to take the holistic view.
Exactly. And that we have these conversations is just very heartening. I mean, it used to be, I felt like I was all alone. Now there's so many people. Like I'm going to next week's conference for Postpartum Support International, and it's like doubled in size since I started attending.
Wow.
So yeah, it's really encouraging to see all of this. Yeah.
Yeah, that's fantastic. I remember when I was working on the floor, having a patient come in, and I was doing a screening for mental health history. And I always used to have in my sort of arsenal of questions that I would ask is if anybody, I would ask them if they had ever had hospitalization for psychiatric or mental health issues. And somebody answered affirmatively that they had that experience. And so I talked to them a little bit about it. And when we were admitting the person, I was talking to the admitting provider, and they were like, well, how did you get the person to talk about that, to tell you? And I said, I asked, I just asked the question. And so I think that and the patient was very honest with me. We had a good conversation, and it allowed me to do further assessments on kind of, well, that was, a while ago in the history, and, talked about like what support systems that they had currently, what they had planned going forward. And I think that just like putting that out there and asking the question to the patient, they don't owe us the disclosure, but when we tell them, or, when we ask those questions, it can normalize, like you said, just asking it like any other physical health assessment question that we would ask as nurses,
Absolutely.
Whether it's, are you, have you experienced shortness of breath, heart palpitations, pain in your abdomen, have you had any thoughts? Are you, just making that part of our assessment, and then using the screening tools that we know have been validated, that can just like normalize it. And we just have to make it part of like our regular sort of work as nurses.
Absolutely. And I really, really think it's super important, Jamie, that it's the provider, whether it's the doctor, the nurse, somebody ask the question rather than waiting for the mother in particular to say, hey, I need help, right? We as people in serving new mothers, pregnant and postpartum people, need to be the ones to normalize and level set. Right? We can't put the onus on the person who's already maybe struggling to say, hey, I need help. Right? So we have to talk about it. We have to screen. We have to normalize. So exactly what you're saying.
Yeah. And that brings up another point that I, wanted to make was I used to teach childbirth classes too. And I used to talk to the pregnant person would typically bring in either their partner or a support person in with them. And I would always talk to that partner or the support person, or if it was the dad or, a partner, whoever who was there with them, about what to look for with signs of mental health issues. Because I think that sometimes when you are depressed or in that depression, especially really deep in it, you don't even know when the last time was you showered, or why you're feeling as bad, or you might be experiencing like somatic issues, like physical symptoms, but not really connecting them to the fact that it might be linked to a mental health disorder. Can you talk about, maybe how to involve partners when we as nurses are maybe in a room where we're doing discharge education, or if we have somebody laboring, how we can kind of talk to their partners and support people about like assessing and keeping an eye out on the person, the birthing person's mental health?
Yep. Great question, Jamie. And leads me to talk about that, partners, whether it's the dad, the husband, same-sex partner, they are also at risk of mental health conditions in the postpartum period, right? When you think about, let's go back to the sleep thing. When you think about having a new baby in the household can be extremely stressful. Let's just like level set right there. Again, it can be joyful. It's wonderful, but there's a lot of crying that's going on, right? There's a lot of sleep that's not happening. And so it can be stressful for everybody. So I think if we just normal level set that is a good way to go into the conversation. Hey, you're going to go home. It's going to be great. And it can be kind of miserable too. So here's what to look for in each other, right? Because we know that if a mom has mental health conditions, that it increases the risk of the husband or the partner having mental health conditions as well. And as many as 1 in 10 dads will experience full outright postpartum depression or depression in that first year following the bringing the baby home. And so I think just normalizing it, hey, this is great. And it can also be a little stressful. Here's what to look for in each other. Talk to each other. How are you doing? How are you feeling? Right? Here are some signs to look for. Inability, back to the sleep thing, inability to sleep when you're given the opportunity to sleep is a big one for people who are experiencing anxiety, right? And I remember, getting up in the middle of the night, feeding the baby, getting him settled back down and be like, oh my gosh, he's going to be up again in 2 hours. Oh my gosh, I got to get to sleep. Oh my gosh, now he's going to be up in an hour. Like I couldn't fall asleep. I couldn't stop my brain.
Yeah, you can't turn your brain off.
Can't turn your brain off. So that's really a good question to highlight. And just, having the parents talk to each other about how's this going for you? Yeah. Okay. This is great. No, this is pretty miserable today. Why are you, how can I help you? Focus on each other. Yeah.
Is there anything else that you wanted to share with us about the work that you're doing or about maternal mental health that maybe we didn't cover in here? Maybe any of the resources that are available for nurses or for families?
Yep. So a couple of things. So first you had asked me like, what gives me hope and what makes me excited? I wanted to mention that really our federal government is paying attention to this issue. The White House put out a blueprint on maternal mental health, on maternal health 2 years ago, and they just put out an update and they highlighted the National Maternal Mental Health Hotline as one of the success stories. There recently, I sat on a National Maternal Mental Health Task Force. It came up with a big report to Congress and a roadmap for how to improve maternal mental health across the country. We have Congress providing funding. We have organizations like the American College of Obstetricians and Gynecologists and the American Medical Association all paying attention to this issue. So that all makes me very excited and gives me hope. And then the other thing I want to talk about is postpartum plans. So we know many, many, many people have their birth plan, right? How they want labor and delivery to go. And I really think it's just as important that we focus on what is it going to be like to bring the baby home. And so all you have to do now is go Google postpartum plan, and, you can find a gazillion of them. When I was working at Postpartum Support Virginia, we came up with one, I'll say probably 15 years ago, because I couldn't find anything that was sort of remotely kind of organizing parents' thoughts about what is it like to come home? What are we going to do about sleep? What are we going to do about food? Right? Like, are we going to order food in? Are we going to prepare food in advance? Or, can we have neighbors bring us food? Childcare, right? If you have other children in the household, what are you going to do with them? Right? When you're taking care of the baby, very practical kinds of things. What are we going to do about visitors? And so it just helps you have that conversation and think about things before the baby gets home. Because once the baby gets home, oh my gosh, you're
winging it.
You're winging it. Yeah. You gotta have some of this stuff. You have to at least have these conversations beforehand. Yeah. Oh my gosh. So my sister, who we were having children at the same time, and she has 5 children total, but she's like, with each child, there's a little bit more of the at home that goes into the stay at home. Like, you can't get out as easily. She's like, and my hands are so busy holding a new baby, burping, changing, feeding, right? So, think through some of these things in advance can be helpful. Yeah.
Yes, I agree. I really enjoyed not only speaking to you today, but listening to your session with AWHONN for a lot of reasons. But I think a lot of it was because it took me back to the times when I had my children and made me fondly remember, actually, like just what those times were like and how they were really hard, but also how They were really beautiful too, but very fleeting. So thank you so much for your work. I'm going to turn it over to Bria. And again, thank you for joining us and sharing all of this wonderful information with all of us.
Oh, thanks, Jamie. I'm so glad you enjoyed the presentation. And talk about fleeting. So my son, John, with whom I had all of my postpartum issues, graduated from college, and he moved out this past week. He's just started his first job, his first real job. So
I don't know if I should congratulate you or hug you.
A little bit of both, I have to tell you. It's a little bittersweet, right? But this is successful parenting. You want them to go, right? But I'm also like, there he goes. Yeah. So
my son asked me last night if he had to go away to college. And there is a part of me that was like, you never have to leave. But I know that's not helping anybody.
You also wanted to take his stinky feet and go somewhere else.
Yes, exactly. Well, congratulations to you and your family. That's amazing.
Oh, thank you, Jamie. This is really a delight to talk with you.
Yes, thank you.
So grateful to AWHONN and all the wonderful work that you and all the nurses do. I love nurses. They're magical people.
Thank you.
Well, I'm really excited about this partnership that we have with MMHLA for this year. Adrienne, it has been a great conversation. And this is definitely something that's ongoing, right? Because you mentioned at the very beginning of our time together that 1 in 5 people giving birth experience mental health challenges. You also just shared with us that 1 in 10 dads experience mental health challenges. So we know this is ongoing. And we can all appreciate how you and founder Jamie Belcito, you answered the call to advance maternal mental health policies, healthcare professional training, and to put out solution-oriented resources for all of us. So thank you so much for your work in this field. Also, your courage.
You're bringing tears to my eyes.
I'm not trying to make you cry. I'm just telling you what you're doing is so important. And you're right. I mean, I had a baby in 2015 and none of this was around. So as the years have gone by, it's exciting to see that we have so much available as healthcare professionals, as public health professionals, and just as moms out in the community. They can just straight up access the MMHLA fact sheet library, right? So, by not keeping your story to yourself, the situation that you had with your son, but by speaking out and sharing your story and then paying it forward, that has opened the door for countless other people. And so we're grateful. And it's a pleasure to have you on today.
Yeah, it takes a lot of courage. It takes a lot of courage to do that, for all of the survivors of all of the different pregnancy-related complications to share so that those things don't happen to other people, and so that we can learn as healthcare providers how to make things better. So these partnerships and conversations, I think, are so important to start and to continue on.
Oh, well, thank you both. Thank you. It's been a delight to talk with you today. And as I said, just a joy to work with AWHONN, and we hope this is the long-term partnership.
Absolutely. So for everyone listening today, we're just thankful that you tuned in, giving us the privilege of your time. Please share with another colleague or friend, a new mom, new dad, someone helping a new parent. Share this podcast episode with them. You can also leave us a review. You can go to awhonn.org/podcast to read Adrienne's full bio and to download all the resources that she shared with us today. You can re-listen wherever you get your podcasts. You can watch us on YouTube. And so we're grateful for you, and we hope you join us again on the next episode of AWHONN Insights. Be well and stay safe.